Good afternoon, I'm Lisa Lord and I'm coming to you live from the Harrison Point Isolation Facility here in St. Lucie. I'm joined by the National COVID-19 Advisor, Mr. David Ellis, my co-host for this broadcast. David, we had 168 cases, record number of cases from yesterday's 1,628 tests. We also had 3 deaths in the last 24 hours. The situation is not a good one at this time for Barbados and its COVID-19 fight.
That's very much so. The last time I was in this area, officially, in the sense that I came on business, goes back to 2005 when Glendale prisons burned down. And this area was a makeshift prison. Since then, I wondered what was going to happen with it because it seemed to be running to ruin. But what we have today is a complete transformation, with all these buildings and the infrastructure to accommodate the people who are here in tertiary, primary, and secondary isolation. As we sat here waiting for this broadcast, you could not help but be struck by what you were seeing. The ambulance coming, the person being wheeled out and taken into one of the facilities, I think it's the secondary facility. The number of patients that are being wheeled to and fro. We won't be seeing any of their faces in this broadcast. But what it does is to underscore the gravity of the situation, confronting not only the people who are here today, but those who are not necessarily here and could easily end up being here at Harrison Point. We are going to be talking with doctors. We will be able to talk also with at least one of the patients. And there are other workers here who will tell us the story of working here at Harrison Point. More than anything else, we hope that this broadcast will help to underscore just how serious the situation is in Barbados at the moment. So this is an uncut broadcast, unedited, coming live. Let's tell you, we have one camera. We will keep rolling. We will walk and talk. It is as if somebody just put a microphone and a camera in your hand and say, go down there and talk. So this is what we are going to do. Sit here sometimes, walk and talk sometimes. And one of the key people that we need to hear from is Dr. Corey Ford. And he is up next to speak with Lisa Lord.
And just to let our viewers know that because of the restrictions, some technical difficulties that we are having, we will have to restrict the broadcast to about 14 minutes. Joining me now is Dr. Corey Ford, the head of the isolation facilities and the island's lone infectious disease specialist. Dr. Ford, it's a busy time. We spoke at length 2 weeks ago and we basically predicted the situation that we now have in our country.
Certainly, Lisa, this is certainly for us in Barbados a very, very difficult. I said before that we are about to go through a storm. And certainly we have started to go through that storm today. You will know the numbers from today. We had a record number of cases on island. But apart from that, there are we are a very serious nation in this country. And I think every single Barbadian really a plea to understand that. If I give you a picture of what's really happening on the ground, certainly not easy. Is a picture that I think should bring attention to most Barbadians today. In our primary isolation, which is our primary ICU, today we have a total of 23 persons. You know that there were 3 deaths last night. And any death that happens is heart-wrenching. It's difficult for everybody, all of our staff. But of those 11 persons, they're between the ages of 17 to 50 years of age. 3 of them are aged less than 30. 5 of them are in the age of ranges of 30s, including some which are intubated. Almost every single person in this facility, barring 3 individuals out of that 23, are in ventilator support. This is very popular, and the age groups for me worse. I'm a young man, and having to come to see this every day, I'm understanding people in the young people and not really understanding what's going on. And I just want to make it real. Honestly, at this stage, I don't know what else to do but to make it real. A few days ago, at one of the schools, a young man who I wish would come forward after. He was all up and he said, "No, I'm fine, I'm asymptomatic, I have no challenges, nothing is wrong with me, I don't want to be here, I'm leaving." He took his bag, Lisa, and he left to go treat his day. That night, the young man went upstairs or whatnot and heard screams from people in that facility. He collapsed. He had something like to the facility. That's message number 1. Message number 1 is this today to all Barbadians. You feel well until you don't. There's always that I'm asymptomatic. But you can be asymptomatic and develop symptoms at any time. And when you develop those symptoms, what's going to happen? The average Barbadian and young person there, I ask you, I'm begging you, cannot play Russian roulette. This is facts. Cannot play Russian roulette. That's number 2. I think where we're seeing, and this is really the picture of Delta, not for Barbados, Lisa, for the whole globe, right? From India to all across the Caribbean. This is the real picture on the ground. More and more young people presented to our secure unit. But the worrisome part for me, which I can't wrap my head around, is that people are not coming forward earlier. I'm telling you as I look straight at the camera today, because I don't know what else to tell you. I told you we're about to go through a storm, and I'm pleading, especially the young people out there, if you feel unwell, please go and get tested. People are here in the 30s, right? In the 30s years of age, and they're presented and ending up on ventilator. Right? This is something that I would really not have wanted to ever see.
You would have mentioned earlier off camera that had, as we said, 168 people to look for cases. That was also a concern for you. We have another isolation that has been set up, but her point is, would you say, overwhelmed?
We certainly are full. We're doing a bit of, and in the back of my mind, I have to find this. And finding this is important because it's more than finding this. It's because as life would have it, the thing about staying home and not coming forward, it means you're going to take it for longer. And by the time you get here, I don't want to have enough ventilators in this country, right? Even if we're more interested to reach every single Barbadian, it's basically not coming forward, not getting tested. You're going to be roulette with, and I think that that's very important. Also, I know that a lot of Barbadians are hesitant about vaccination. They're hesitant about unknown, and I understand that. I've said it before. I said it 2 weeks ago, and I understand that, right? But I'm telling you that the numbers that we're looking at are always the same. There has been no difference, and there's no difference in the rest of the world. That's not to say that there's hesitancy, right? It's not wrong. You're hesitant, and it's understandable. The longer you take to make that decision, and I'll tell you why I say that. Real life experiences. If you know, you see the people who died recently, a lot of them are in the age. 3 who died in the last 24 hours are all older people. Some of them are in house, so how did they get it? They didn't go anywhere. People brought it home to them.
You want to try the CDC mic?
How many people come? into the home for unvaccinated. That's not, I don't know what else to say. But they're among those kids at this point. To me, that's a little tough.
But you can't go in there? You can't go in this?
I just want to say that we're having some technical difficulties right now with the sound, and we're getting some feedback from the public that they're not hearing well, so we're trying to rectify that problem. But as soon as we do so, I think we will be able to continue and enabling necessary details.
Yeah.
We can't make major concerns. Identifying here. A critical issue, Dr. Ford, is where are we? You said it's like a storm. Where are we in this storm?
Thanks, David, for asking that question. And the truth is, we are now entering the storm. And I spoke to you 2 weeks ago. I told you we were about to enter the storm. We are now entering the storm. And if you're now entering the storm, and we're seeing these alarming numbers, but also we're seeing the level of individuals on the ground who almost, for most part, as it stands right now in our prime installation, everybody's unvaccinated. That speaks a picture. I don't think I need to say it. It looks like the rest of the world. It's not numbers that were created in Barbados. If you pull numbers across the whole Caribbean, Bahamas, Grenada, St. Lucia, Jamaica, it's the same. The people who are getting extremely ill are those who are unvaccinated. And I encourage all the young people out there to go out and get vaccinated. I'm sure the experience, if I had to take, I wish I had the opportunity, I said it before, and it's going to happen, you know. I wish I had the opportunity to bring some younger people on the bus and show them what we have to endure from day to day. But the team is tired. The team is tired, and I think every single Barbadian needs to understand this, to be very straightforward. If it is that we're going to survive this, it's going to require the help of every single person looking at this camera today. Every single one of you, you're going to have to play your part if we are going to get through this as a country. We cannot at all be divided. We might disagree on when you want to get vaccinated. We may disagree on, what drugs you want to use. We might disagree on these events. But I'm telling you, as a country, looking at what has happened in other countries, it is strategically important that each and every single Barbadian today, as they listen to my voice, understand the sort of issues that are ahead of us if we do not take heed. I said it already 2 weeks ago. We're at this point. We're in the storm. If you're going to get out of the storm, it requires each and every one of you to follow a few simple things. Mask wearing. This is sometimes you go across Barbados,
And you're still seeing people without masks.
it's unbelievable, and it's heart-wrenching because I'm seeing the far end of it, right? I'm cladded a bit differently to normal when you see me. It's because we've been working all day. I have 168 people out to deal with, plus, potentially, right? Wear your mask. Get vaccinated. Protect all of those older people at home. Because those older people at home who became positive and are no longer here today, and I give sympathy on behalf of the team here at Harson's Point to their family. The challenge with that is that they were helpless in this situation. And I'm asking for people, if you have older people at home, contact the Ministry of Health. You have to really get a system in place to get to those people where it matters, to get them vaccinated.
No, I know we don't have a lot of time, Dr. Ford, but however, you had the full support of the Minister of Health and Wellness, Lieutenant Colonel Jeffrey Bostick, in terms of some of the attacks on social media of your staff. What is the morale like of your staff at the moment?
I think, Lisa, I don't even know how to answer this one because my staff works overtime, more than 12 hours, sometimes double shifts. Sometimes many of us don't sleep at night. And it's hurtful. But I understand there's a lot of anxiety, there's a lot of social media going on. But to address that issue straight on, head on, I think is important. On behalf of the staff, straightforward. We provide a level of standard care that's provided anywhere on this globe. In fact, I think we provide a higher level even as provided in some countries. There's some things that we have here that many in the globe don't have at this particular point, and I'm thankful.
And I do believe I will now throw to Mr. Ellis.
Yes, I want to apologize for the technical quality that has been emanating from the broadcast. And we're going to take a break here and try to see how we can rectify it. But we have to make every effort to see if we can get this information to you in a way that is clear and that you can easily understand. So do accept our apologies.
We'll be back.
Where are we right now? You have described this situation as being like a storm. Where is Barbados in this storm at the moment, and where do we seem to be heading in the short term?
I think we certainly have entered the storm. In the short term, where we are will depend on every single person listening to me, to be very clear, David. The only way we're going to make it out of this storm that we're in, we saw 168 persons today, 100 and something the day before. The only way we're going to make it out of the storm is for people to just listen and fall in line. And what do I mean by that? In short, people need to wear their masks, don't congregate together, go and get vaccinated. Protect all the older people in your household by getting them vaccinated. You just got to go out there and do it. Is to protect them, because the truth is they are the vulnerable ones. They're the ones with the diabetes and hypertension. But also for the young people out there who think that you're infallible, that nothing can happen to you, I will take you into the ICU and show you what it looks like. I gave the figures before, just now on live, as to where we are. A total of at least 11 out of 23 people are under the age of 50 years of age. That's significant. 3 of them, as I mentioned before, we know what the age groups are already. Yes? Within that below 30 age group. Above that, in the 30s, generally, we have another set of people again. This is worrisome, David. And it looks like the rest of the globe. It is no different than what we're seeing in other Caribbean countries. And we really can make a difference in this country. We have to protect our young people. We have to protect our old people. And what really it is in my mind is that we must not be selfish in our thinking. and be selfish in what we do as citizens. We have to be responsible citizens in every single way if you're going to make it safely out of the storm. And I will tell Barbadians, in the midst of a storm, we all know one important fact for a hurricane. There's the eye. So there's a point that may come where things seem calm. But as that point comes, we also need to consider the next part, which is important, that there's more fury on the other side. But how long we stay in that calm will be dependent on the things that I have continued to mention over and over again. And I saw this coming to us as a country.
Well, you saw it coming 2 weeks ago.
Yes, I did.
Now, 2 weeks from now, where will we be if we keep on this trajectory?
If we keep on this trajectory, I am telling you, I'm going to say it. And it's hard for me to say as a physician. My job is to save lives. But I can't guarantee that I can save every single Barbadian in this country who gets ill. Right? I can't guarantee that we will have enough ventilators if we continue on this trajectory like this to save every single person in this country. Because no country in the globe has done that. They have all ended up in issues with ventilators and oxygen. And we have all of these lovely things. But how well we do will depend on what I've said a million times over. For people standing up. Young people, I am begging you today on live TV not to play Russian roulette with your lives, right? You don't know or you're uncertain, right, about what will happen about vaccines. I had my queries too, right? But what I can tell you is if you get ill with COVID, right, basically what you're doing, one or two things can happen. You can go fine or things might go badly. And I, as a doctor, I cannot predict which one of these would be you. So I'm asking you today, I'm pleading with you on national TV, on live, wherever this goes, to repeat it over and over to every single person in your household, to your old granny in your household today. I'm asking you on behalf of the staff here, who are basically out to all. We're out to all, right? I'm pleading with you today, right? Not only based on the numbers today, but based on what we're saying right over here in this building. I'm pleading
primary
with you.
isolation.
Yeah, primary isolation. I'm pleading with you. We are of horrible state in this country, potentially, and it's up to you to make the difference.
Now, let's be realistic about this. If people got vaccinated today, it takes time before the vaccine takes effect. So in between now and then, we have a problem. Is the horse out of the stable?
Well, one could think of it like that, but I can tell you where vaccines are concerned, any sense of protection is important. So after the first vaccine, after a period, it gives about 30% or just 20 to 30% protection from getting hospitalized and getting very ill. And even a small percent will change the trajectory of where we are. Ideally, David, I would love 6 weeks for the storm to come and we to be in the eye of the storm. Because we know when we hit the other side, we're going to be okay. The problem in Barbados, people have to understand, is not what people think. The problem is actually this. The problem is basically that we will overrun our healthcare system with a large percent of unvaccinated people in our population. If there's a large percent of unvaccinated people in our population, we will overrun our healthcare system, right, in terms of allowing people not to have to go on ventilators, for example, or to be in primary isolation care for 21 days. This is particularly important.
Where are we here now on the compound?
So we are here now at the outside the tertiary isolation, and one of the patients has really consented to speak to us, and I think several of them want to speak, but you know we have some time constraints as well. Yeah. So it'll be interesting to hear what he has to say. I'm going to step off and let them do what they have to say and their own experience. But I think Barbadians have to realize this is real. We can't pretend that we are not where we are at this point. Right. I'm not being alarmist here. I'm just telling you reality. Just as I told you 2 weeks ago on national TV, that this was a serious event. I'm telling you today that we've entered the storm, and it's up to you to hunker down and do all the things that you're supposed to do to get us through this, to the eye of the storm. And in the eye of the storm, when we're all vaccinated, we can move into the next part of the storm unchallenged.
But before you go, you have to tell us where we are likely to be within the next 2 weeks, given the fact that we do not have as many people vaccinated that could stop us or stem the tide that we are into right now?
Right. So
what's the projection?
So I think the UWI has already projected quite well, and I think they did it the first time around. We could have, if some of the barriers not in place, we can have almost 500 people a day, as has been said before.
How do you cope? I mean, how do you cope tonight? When more people come in here tonight, what happens?
So people will come here tonight, and we have some other admission sites we've opened up, but that's not sustainable forever. The only way we're going to curb that is by people's behavior, and to deal with people's behavior, and that will allow to stop our spreads, especially in households. I will tell you that there are so many households that are admitted in facilities that are positive. Young children, older people. I don't know.
I suppose people need the stats. If you could provide us with the number of households that are affected like that, because a lot of the information is still not available. You have it, but people in the country will still be guessing as to what is happening. They get the cumulative of certain things, but perhaps we need a little bit more information. Now, this guy that I'm speaking to says he didn't want his face on camera. So, good afternoon, sir.
Yes, sir. Good afternoon.
Good afternoon. Tell me about your experience with COVID. How long have you been here now?
I'm being here today is actually 4 weeks.
How has the disease affected you?
It affected me tremendous because I didn't expect to get COVID.
Why not?
Well, I normally don't go anywhere, and I work alone at various places. So when ministry called me this Sunday and told me that I have to report to the Hilton, I asked them why. They told me my cousin haven't told me that he tests positive. I said no. And so ministry told me that I had to report 8:30 the night at Hilton, and I was there for 2 days, where the Monday I was being tested, and the Tuesday evening the tests come back positive, and the Wednesday morning the ministry vehicle of health vehicle come and transport me to Harrison Point.
How sick have you been? Because as we speak, you have oxygen. An
At
oxygen
the time
tank.
from the Hilton, I did not add any oxygen, but as soon as I come up here, they do tests with me and put me right away from this section here straight over into ICU, where I was immediately on oxygen.
And how sick have you been?
I was being real sick, where from the oxygen I went the night into being put on ventilator, where I was on ventilator for 2 weeks, and the ventilator experience is not an easy experience for anyone. It's the experience where there is period of ventilator hours they put you on, where it could be 4 hours, it could be 6 hours, 8 hours, or even 10. So when you're here, you have to go upon a 4 hours experience. Of 4 hours, you feel is real good. But once it's over 4 hours, understand, there is where thing where the when I first got the respirator put on me on the ventilator, it was terrible, real terrible. That
what's your message to the rest of Barbados this afternoon?
The rest of my message to Barbados this afternoon is try your utmost best not to get COVID. Do not go places is where you aren't supposed to go. But sometimes it could come right inside your house.
Did it change your speech?
Huh?
Did COVID change your speech? The way that you talk?
Yeah.
It changed the way that you talk?
If I think.
Did it change the way that you talk?
Yes, it changed the way I talked, because always see it is something can happen to anybody at any time.
Well, I want to thank you very much for talking with us, and I wish you the very best.
Yeah, and do have a good night.
Thank you very much. Well, we're going to walk back to where we came from, and we have Felicia Gill, clinical psychologist. Good afternoon, Gill.
Hi, good afternoon.
Tell me a bit about yourself and your work in psychology over the years.
I have been working here at the Harrison's Point Isolation Facility for 9 months. I'm also responsible for the external facilities as well. And as a clinical psychologist, I have been practicing for 5 years now.
Share with us the experience of working here with COVID ever present in your mind.
Working here at the facility, it has been an experience, I would say. I'm responsible for the patients and staff. And when I say it has been an experience with the staff, you see, staff are overwhelmed, they're overworked, and we're also understaffed. And then we try our best to work with the patients. And as you see, the numbers have been steadily increasing, and that has even made things a little bit more challenging as well. And even though we are feeling, overwhelmed at this point, we consider ourselves as a team and as a family, and we support each other here. So when we recognize that, it's becoming a bit challenging, we just give each other an encouraging word so as to help the other to keep going on. Because this job, it can be a bit draining. We're trying to do our best for our country to help the patients as best as we can. And so as to be re-energized, we just try to support each other throughout this journey.
What has been your hardest moment to date?
My hardest moment has been working with the families of those who have died from COVID. So what I have to do is, as soon as the patient has passed away, I speak with the family. I sometimes relay to them what has happened, and then I'm there then to help them to cope with the situation. And also to even some of the patients who might have passed away, I would have been speaking with them before that point in time. And what I would say to my experience, working with patients in the primary isolation facility, or what we know as the ICU, that has also been challenging as well. Because whenever I go into the ICU and I see the patients, those who are on oxygen, those who may be on the CPAP machine, and then I have to go and, try to help these patients as best as I can. Because this is very difficult. Patients who, things might have been okay, but then having their condition deteriorated to a point where they now have to use oxygen. And I really try to encourage the patients. I really try to help them to see their strengths. And I use various mechanisms just to help the patients to cope while they're in primary isolation.
What are you going to tell the younger people in Barbados today? These people between the ages of 12 and 21.
What I would say to you And I'm going to say this based on my experience working with the teenagers and the younger children here at the facility. I would say protect yourselves. You know what's happening in this country. I want you to wear your mask. I want you to social distance. I want you to think about your friends, your classmates. I know that it's difficult being separated from your friends. You have online school, and I know that it can be a bit stressful, and you can even become a bit depressed. Yes, children do become depressed, but I want you to just remember the reason why we're doing this. You want to protect yourselves, and you also want to protect your family. And we can do this together just as long as we do what we are supposed to do.
And for you, what has it done to you personally? Family, you talk about family, you talk about life otherwise.
Mm-hmm. For me, it has really caused me to just try to encourage my family to do what they need to do as well. And it has been a change because when I go home, I don't go into the same quarters as my family. I change on the outside, and it's a strict protocol that I follow because I want to protect my family. Because at the facility, I go in with patients, and that's what I do on a daily basis. And because I know that I'm exposing myself, I want to protect my family. And also to help with that, that's why I got vaccinated, and I also encourage my family to be vaccinated as well, so that we can help each other through this time.
Thank you, clinical psychologist Felicia Gill. Thank you very much. And let me cross over now. We go back to Lisa Lord, and she has one of the doctors who's been really on the front line of this fight against COVID in Barbados.
That's right. If I could just borrow your mic, as I said, it is a moving broadcast, and we have Dr. Amory Hassel. She's a pulmonary and intensive care specialist, and she's actually in charge of the intensive care unit at the Queen Elizabeth Hospital. Dr. Hassel, how does Harrison Point differ from what you see on a day-to-day basis in the ICU at the QEH?
Well, so my non-COVID job is at the QEH hospital, and we have a ICU that can hold about 10 beds, but we range probably about 8 to 12 patients on a general daily basis. When we get really busy, we're up to about 16, 17 patients, and that's when we're really maxed out. Here at this facility right now, we're having 27, 28 patients in the ICU. And then in secondary, which is our step-down unit, we're having another over 30 patients there. So we're managing over 60 patients here, where normally we would be managing 12 patients, 14 patients max. And we don't have any more staff than we would have at the QEH hospital. So our workload has tripled, doubled, quadrupled compared to what it would normally be. And of course, you have to add that now we have to function in PPEs all the time, which is a little added burden to what we have to do.
If you could just move over here. I'm not sure the average Barbadian knows what a ventilator looks like. We hear about them all the time. This is a ventilator. But before we go into the demonstration, I want you to explain for me how COVID impacts the lungs specifically.
Okay, so COVID is an infection which, when it gets into the lungs, causes a lot of inflammation. And that inflammation then can lead to the lungs being collected with like fluid or pus-like stuff, so oxygen can't get in. Normally our lungs have two functions: get air in and out, and then extract the oxygen of the air you breathe in and put it into your bloodstream.
Sorry, we seem as though we lost audio there for just a minute. Do we have it back? Yes, it's on now.
Okay.
Sorry about that, Dr.
No problem. So part of the problem with COVID is you can get, as you breathe in, you can't get the oxygen through the lung into the bloodstream. Mm-hmm. And so your lungs have no longer the capacity to oxygenate your body. And obviously you need oxygen to all your organs in order to function. So for that reason, if the first stage in general, if you can't get oxygen through your lungs, is that we put you onto something called just normal oxygen supplementation. Okay, let's get my little props here. With regular nasal prongs, everyone pretty much has seen this.
Great. This
is what we commonly use first step. If, however, the patient still can't get enough oxygen to get into their bloodstream, then we move up to the big boys. Right, so this is a ventilator. And the purpose of this ventilator is really to blow the air into your lungs. Mm-hmm. And first stage from this will then become
the mask.
The nasal prongs. So this
okay.
one looks a little bit bigger. So when we say that people are on high flow nasal prongs, this connects to this here. which connects to your nose. And we blow air in at a much higher rate than that could go through that little one. When that doesn't work anymore, then we go to the mask. And this is the one that's the most uncomfortable. So this goes on here.
And that's strapped on.
Strapped on tightly onto your face. And so if you're claustrophobic at all, it's very difficult to use. But with this part, we can actually oxygenate and ventilate your lungs much better than if you just use one like this. So depending on the severity of the degree of disease you have in your lungs, we escalate up. When we get to this stage, we go between the two because obviously you can't stay on this all the time. And this is what patients in there go through on a daily basis, some of them for over a week, 10 days, just to try to get their lungs better so the lungs can start to function again, so then we can degrade back down to the smaller oxygen and then off the oxygen. Now if all this fails, the last resort is the tube. The tube goes down through your throat into your lungs, connect to this machine. We have to sedate you. You're no longer conscious. And this is our last resort to try to get oxygen into your blood system.
In terms of your success rate using the ventilators?
Well, if you use the ventilators with the high flow and the mask, we've actually done pretty well. We've had a lot of patients, some of them take a week, some of them can take 2-3 weeks, but we've had a lot of patients actually get better and leave. If you have to go down with the tube, which means the lungs are extremely damaged, our success is not so great. We've only had 2 people so far come off the machine. So we try our best to keep use these two as best as we can, talking with the patients, trying to convince them to use this because we know that we don't want them to move on to this.
And you mentioned to me that you're the only intensive care specialist down here at the moment. You're working some very long hours, and you had indicated that you're disappointed that people are measuring your success by the number of deaths, or failures rather, by the number of deaths we're having.
Well, I think this is the only disease in the world where every time someone dies, you record it, and it's announced publicly. I mean, people are dying every day at the hospitals, and nothing is recorded there. And so, even though people are going to die, and we know that, no one talks about the people who actually made it out with these 2 mechanisms of getting them out, and we have a lot higher percentage of that.
Dr. Hassel, thank you so much for talking to us, and thank you for your service. I'm going to hand over now to Mr. Ellis. I believe he's going to speak to somebody now in infection control.
Well, we do have a limited time now. As we said earlier, we only had about
40 minutes.
40 minutes, and therefore I think the person that has try to wrap up with here now is Dr. Ford again. And there's some people behind the scenes too, sir. You are?
Hey, good afternoon. My name is Ramel Jones.
What do you do here?
Infection control officer here at Parsons Point.
What does that entail?
Basically, right now we do surveillance and reporting. But majorly, I do training. We recently trained 172 persons for this particular event. That's basically it right now.
How has all of this struck you as a person, though?
Pardon?
How has it all struck you as a person, coming to work here, seeing all that is happening here?
Previously, I was employed under the QA, so I pretty much am aware of this kind of environment. But recently, I've seen more young people in a medical facility than I've ever seen before, even younger children. So it is a very serious situation. I hope that the Bajans will take it seriously.
And who else do we have?
I recall that.
And
I'm an orderly.
area as well?
I'm an orderly.
An orderly?
Yeah.
Okay. So for you, what has the experience been like, Rico?
Kind of eye-opening, to be honest, because on the outside you can't really gauge the seriousness of the matter, but from being on the inside, like, you get the full thing.
Well, thank you very much for taking time out and speaking with us. Because of the limited time that we have had, we will have to wrap up this particular broadcast. But more than anything else, we hope that the message has been conveyed that Barbados is at a point right now, a tipping point as it relates to COVID. And we have heard from Dr. Corey Ford, and we've heard from some of the others here, that we are essentially in the eye of a storm, and it requires each and every one of us in the country to take this matter far more seriously. Dr. Ford, your closing comment?
My closing comments today to all Barbadians is to take heed of what's ahead. Wear your mask. All young people, all older people. Protect your old granny who's in the house. I want my team to come guys. This is important. Come, because I think you have to understand, you have to understand that this is a hard bunch of very young people who step forward in this country to try to protect us in a very difficult time. And I think that the country needs to understand where we are at, the sort of work that every single person here is doing. And you will get to see inside the ICU, unfortunately because of the logistics, but we will do that today. I promise you that, right? But this is a hard-working team. The operational manager is Carlo Rowe, and all of these guys who have stepped forward for this country in a time which I believe is a desperation time, in the middle of a storm. And I hope that we get closer to the calm, but that calm is going to be that every single one of you that's listening today, protect that old granny in the house, protect that 2, 3, or 5-year-old, 15-year-old who was in ICU a few days. I'm asking you to step forward, go and get vaccinated, and this is not a vaccination drive, right? Go and get vaccinated and protect them from being in that ICU, being in that machine as all of you saw today, being in that mask on their face, right? And they're going to get graphic later and showing you what's going on because people just are not understanding the gravity where we are. And as I finish off in what I have to say today, David, I'm going to tell you this, that every single day I get up, I know millions of Barbadians listening today are praying for me and this team right here. But I pray for myself every day. And one of the things I pray is that people out there in Barnyard, Barbados, that God speaks to them. Whatever God you listen to today, that God speaks to you and tells you basically to get up. And don't only think about yourself. Think about your neighbor, because that's who true Barbadians are. People who will get up and take care of the Barbadians. If you see someone not wearing a mask, talk to them about it, right? If you see somebody hesitant about vaccination, you had your vaccine, right? And you walk in and you're safe, talk to that individual. If you see a young person out there who thinks that they're fine and nothing can happen to me, remind them of this video today. You circulate a lot of things out there. A lot of it don't be true. But I'm asking you today to circulate this team who has been working valiantly for a year and a half for this country. And not only ones who are here, the ones in the EOC and the Ministry of Health, the Minister of Health himself, and for all of the work that the QEH through the Board of Management and Hospital, and I have to mention this Juliet Bino Sutherland, who has been a superstar, I think, for us down here at Harson's Point and provided almost every single thing, and Dr. Abdul Mohammed. These are the true people who have stepped forward to help this country, and you have to help us to get there. The 168 cases that we have today is a challenge. We will see bigger challenges ahead, but how big those challenges are will depend on you. They're tired. Are you all tired? How tired are you?
Exhausted.
Exhausted. And it's up to you who are listening today to make it happen. I can't do any more. We can try to save every life that we can, right? At our own life risk. And some of us, can't say who in the crowd, but some of us have even become infected with COVID. Not me, just in case you're wondering, right? But they're still here standing, fighting even after that battle. And that speaks a lot. All you young people out there who think you're inflammable, I'm telling you, and I'm going to show you today in ICU on a different switch, David, what's really going on in there, because that's the only way you're going to understand. And there are others who are not here, who are behind the scenes, who are fighting the battle, and I want to thank all of them today. But you have the choice. It's up to you. It's totally up to you right now.
Thank you, Dr. Corey Ford. The final word is yours, Lisa Lauren.
Despite the challenges that we would have had, the technical issues in terms of audio at the beginning of the broadcast, I'm sure that the message Dr. Ford got across. We want to thank him and the team here at the Harrison Point facility for the yeoman service that they're giving to Barbadians at this time.
Thank you.
And thank you for watching.
Good afternoon.